Assistant Professor of Audiology at Arak University of Medical Sciences. I am very pleased to be as a virtual presenter at this conference. My presentation title is about the combined transcranial direct current stimulation and tailor-made notched music training.
Excuse me, sir, can you make it full screen, please? Can you make it full screen?
Full screen, okay, of course.
Yeah, thank you.
Is this visible for you?
Absolutely, you can start the session.
Okay. My presentation title is about the combined transcranial direct current stimulation and tailor-made notched music training (TMNT) in treatment of tinnitus patients. This presentation is based on my PhD thesis of audiology, and it was accepted in the otolaryngology journal. Subject to tinnitus is the perception of the sounds that are absent in the environment, but the auditory system cannot ignore them. According to epidemiological studies, about 20% of the general population have some form of tinnitus. In this figure, you can see the prevalence of tinnitus based on the gender and age. In both gender, the prevalence of tinnitus is high and it grows with age, but in females, the prevalence is less than males. The neurological mechanism of tinnitus is not completely well understood yet because it is very difficult to establish the correct mechanism for tinnitus. And based on the other studies which conducted in this field, it is the more involvement of auditory system cannot justify the complication of tinnitus, such as distress. Based on this, tinnitus networks model was introduced by the former audiologist or otolaryngologist about the tinnitus. Tinnitus network consists of pathways in the auditory cortex, frontal cortex, and limbic system. And based off this model, you can see the auditory system is not merely involvement in the perception of tinnitus, but other networks such as limbic system and frontal cortex can induce or justify the sound of tinnitus which person hears it. The cortical hyperactivity caused by tinnitus may be suppressed by neuromodulation techniques. Neuromodulation techniques can be categorized at two, which is, you can see them. Neuromodulation, or based on the physiologic, you can see the TRT model, neurofeedback, sound therapy, and CBT. Based on my field and as an audiologist, you can see the sound therapy. Sound therapy is more popular method for treatment of tinnitus and is conducted some categories, subcategories such as ACRS, CI, music-based, HA, and maskers. HA means hearing aids, which can use for tinnitus subjects with hearing loss, cochlear implant for them, which have the severe or profound hearing loss, and music-based techniques, which is a new novel techniques, combines two subcategories, Hildeberg and TMNMT. TMNT is more novel techniques for tinnitus patients, and it was introduced by 2009 by Okamoto. Neuromodulation techniques, which based on physical base, you can see them based on magnetic and electrical. Magnetic, which is the RTMS, and electrical is tDCS. tDCS and TMNT can be very good techniques for treatment of tinnitus. And this subject, you can see them based on some introduction to them and introduce you. The transcranial direct current stimulation tDCS is one of the most commonly non-invasive neuromodulation methods used over the past decade. The primary mechanism of tDCS is subthreshold modulation of resting membrane potential of neurons. Based on this, you can see this anode and cathode anodal stimulation, which may cause depolarization of the cells, and cathode stimulation cause the hyperpolarization. And based on this, anode and cathodal stimulation can work together, and the final result is the modulation of the cells. A novel and effective non-invasive neuromodulation technique, which presents farmer for you. You can see them in the chronic tinnitus patients, and it is based on sound therapy, and which you can see them based on sound therapy. It can be a very popular techniques for audiologists and otolaryngologists to management of the tinnitus patients. Tailor-Made Notched Music Training is based on the hemostasis mechanism and the mechanism of this inducing the asynchrony in neural activities by lateral inhibition of neurons, which means the notch area of tinnitus frequency can result in the reduction of the auditory cortex. As you know, the tinnitus patients feel the sounds of their tinnitus at the definitive frequencies, such as 4 kilohertz. In this patients, 4 kilohertz can cause the tinnitus perceived by the patient. In the TMNT technique, by lateral inhibition, you can reduction the auditory cortex by notch in the music of favorite for the patients. It means by such softwares you can notch the music of the popular notch the music by the frequency of the tinnitus and result in the reduction of the auditory cortex hyperactivity in this frequency. Due to the lack of the definitive treatment for tinnitus and limited usefulness of individual methods, in this study, a combination of tDCS and TMNT was used for the tinnitus patients. In this descriptive analytic study, 26 patients with chronic unilateral tinnitus of right ear were randomly divided into the CTG and CG groups. CTG means the clinical trial group, including 4 male and 9 females between age of 45 years old, and the CG or control group, which consists of 8 males and 5 males, which means age of 35 years. They were enrolled from April 2020 to March 2021, and 13 patients in both groups was enrolled in this study. In CTG, 6 sessions of tDCS with 2 milliampere intensity for 20 minutes with anode on F4 and cathode on F3 were conducted. F4 means the right DLPFC, right dorsolateral prefrontal cortex of the tinnitus patient, and F3 means left dorsolateral prefrontal cortex. Were conducted in these patients simultaneous with tDCS sessions, and based on TMNT and based on the favorite of music of the patients, the participants were asked to listen passively for 2 hours per day to a CD containing of her favorite music with proper notch applied in the spectrum according to the individual tinnitus based on the pitch matching. In this pitch matching, which conducted for the patient for the definitive frequency of the tinnitus of the patient. After them, the frequency were recorded, and the music was notched at the frequency which used previously. In this figure, you can see the parameters of the study. Signal frequency 20 Hertz, 2 kilohertz. Signal type is shame wave for the shame group, for the control group, or the tDCS or direct current for the group of the patients. And amplitude was enhanced in the cases, and you can see them in maximum as 2 milliamperes. And duration of every session up for these cases is 20 minutes per sessions. And sessions were conducted 2 times on the week. And this TMNT spectrum, you can see the original music of for the patients and the favorite for the patients. You can see them, the spectrum only notch the frequency of the tinnitus. In this example, it was used for a patient with a 4 kilohertz tinnitus. The treatment outcomes were measured by psychoacoustic methods such as loudness matching and pitch matching, psychometric such as VAS. VAS means visual analog scale, and it was subcategory of the awareness, loudness, and annoyance. And the tinnitus handicap inventory scores, which means 25 questionnaires were conducted for every patient before and after the seasons of the case were enrolled in the study. Cognitive assessment was conducted for the patient with subcategory as 2-1, randomized dichotic digit test, RDDT, and dichotic auditory verbal memory test, DAVMT. These two tests was as used for these cases is a Persian version of the tests. Because my case is in Iran and Persian is the language of the cases were enrolled in the study. Repeated measurement test was used for statistical analysis in CTG, the tinnitus, loudness, annoyance, VAS scores, and also THI were reduced significantly. You can see the tables. In addition, DAVMT and RDT score were enhanced, but these changes were not observed in the CG, which means in the control trial group or CTG, these techniques combined with together causes the enhancement of the auditory and memory, auditory attention of the cases, and the majority of these cases was enhanced as statistically significant. And in the conclusion, based on this study, it seemed that the combination of tDCS over the DLPFC and TMT lead to a reduction in the loudness, awareness, and annoyance, or also the THI, and also disability induced by tinnitus in CTG in short term. In short term means 30 days after the last season of the intervention. Also, the finding has been persistent over months after the treatment of the seasons, and also 6 months after the treatment seasons. And furthermore, this method showed an improvement of the cognitive function for these cases based on the method I was present to you, such as the AVMT and RDT test in the CTG group. Thanks for your attention to my present. I wanted to just present my result of the studies, and it was the new method for the tinnitus patients. As you know, it's one of the most challenging problems in the field of otolaryngology and audiology, and these cases can be category and enrolled in the study for more studies in the future. And you can see the result of the the study in the journal and my article, which was published formerly in the American Journal of Otolaryngology.
Thank you, Dr. Sirvan. Excellent